So now we're going to go ahead and perform this treatment. And you're going to see Ashley's going to place this in just pretty much along the same lines as you will go ahead and do a regular dermal filler. And we're going to do this a couple different ways here. As you're going to see, Ashley's going to have a couple of different patterns. But one of the ways is, again, just follow up the nasolabial folds. You've got to be trained on this. You've got to be in the right plane. And certainly we've got to hold your hand. Once you learn how to do this, you see this is a very, very quick treatment. Once you really understand what plane you're supposed to be in, then that's going to be in the subdermal space, which is right underneath the dermis, right above the subcutaneous tissue here. Now here, what Ashley is doing is she's going to create some planks going both ways, kind of a crisscross here. And imagine that you are taking dermal fillers and placing them. You've got this little string of dermal filler, so you can place them exactly where you want to place them. So all Ashley is doing is she's already assessed where some of that volume loss has been and is going to put down planks. And we talk about this when we use a regular hyaluronic acid dermal filler. It's the same way, but this is going to create, and the body will start to create as these break down, a great, great natural result, because her own body is going to create the natural collagen fill that we want in this area here. And that is what is so nice about this treatment here. And, you know, with filler, once you're under skin, you can place filler where you want. It doesn't always go where you want it exactly, and because the hyaluronic acid fillers are gels, sometimes they will migrate a little bit. They may not stay exactly where you put it, and we've seen this happen. These we know are going to stay exactly where we put it. So again, imagine you can place dermal filler and be really precise, and that same dermal filler, and again, you've seen this now right before your eyes, you get an immediate visible result because of the immediate structure that you placed underneath the skin with these solid filler smooth PDO threads. So you get that, and then it gets better and better over time. And again, because this is her second treatment, this is really, look how nicely filled that is. Now, this wasn't the deeper side just yet. This is a little bit deeper on this side, but look how nice that's already filled in, which you can see already. How are you doing, Sarah? Okay, yeah, she's a trooper. She's doing great. What's next, Ashley?
We are going to do her downturn oral commissures.
Right, and go ahead and watch this. Same, again, this is pretty much the same direction that you would go ahead and place a hyaluronic acid dermal filler here, and this is going to be across. And this, by the way, is a special AAFE protocol that we've seen other people get trained by other organizations here, and they typically will go ahead and place dermal filler like a nasolabial fold in this. Much better to go across the oral commissure because that fills it and picks it up here as well here. So we're going to use that same technique that we would use for dermal fillers. We are also going to use it on the oral commissures. And as part of this, you'll see Sarah's before and after. This is a huge improvement from her before picture before her first appointment. So this already, while they're slightly downturned, I mean, they were majorly downturned before we started all of this treatment. So now, again, same kind of things. What Ashley has done has put some planks there, and that is going to put it exactly where we want it with the solid filler smooth PDO threads, which again is a big advantage. And you all know dermal fillers, by the way, is great in all these areas, but this area, the oral commissures with hyaluronic acid dermal fillers, is always a little challenging, because if you don't get that pickup right away, then what happens is, and many of you have seen it because you've been trained, is you keep adding dermal filler here, hyaluronic acid dermal filler, and in the hopes that it'll pick it up and straighten it out, and it gets kind of bulky. When you do that bilateral manipulation with all that dermal filler, it gets kind of bulky, and you almost have to kind of squeeze it down and manipulate it.